Freezone Liquid is a product that can be used to treat common skin and foot warts, as well as to remove corns and calluses. It contains two main ingredients, salicylic acid and flexible collodion. Salicylic acid works by breaking down the top layer of skin and increasing skin moisture, which causes the wart, corn, or callus to peel off. Flexible collodion forms a protective coating over the treated area, keeping it clean and maintaining contact with the skin. It's important to note that this product should not be used on the face, moles, birthmarks, warts with hair growing from them, or genital/anal warts. If you are self-treating with Freezone Liquid, be sure to carefully read the package instructions before use to ensure it is right for you. When using Freezone Liquid, start by washing the affected area and soaking it in warm water for about 5 minutes to soften the skin. Dry thoroughly, and your doctor may direct you to gently remove the top dead layers of thickened skin. Do not use sharp objects. Using the provided applicator, apply a thin coat of the medication to cover the entire wart, corn, or callus. Be careful not to get the liquid on surrounding skin. Let it dry and repeat this procedure 1 to 2 times daily as needed until the wart, corn, or callus is removed. For warts, you may use this product for up to 12 weeks. For corns and calluses, you may use it for up to 2 weeks. Wash hands after use. Do not use this product on irritated, red, or infected skin. Avoid contact with the eyes and face. If this product gets on these areas or on healthy surrounding skin, wash it off right away. Do not apply a large amount of this medication or apply it to a large area. Do not use it more often or for longer than directed. Avoid inhaling the fumes from this product. If your condition lasts or gets worse, or if you think you may have a serious medical problem, stop using this product and get medical help right away. After applying Freezone Liquid, you may experience mild skin burning, redness, and peeling in the treated area. If these effects persist or worsen, please inform your doctor or pharmacist. Your doctor has determined that the benefits of using this product outweigh the potential side effects. Most people using Freezone Liquid do not experience serious side effects. However, if you notice any unusual changes in the treated area, such as discharge or bleeding, or the formation of a deep sore/ulcer, contact your doctor immediately. Although rare, a serious allergic reaction to Freezone Liquid may occur. Seek medical help right away if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. In the US, call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before using Freezone Liquid, make sure to inform your doctor or pharmacist if you are allergic to salicylic acid, aspirin, NSAIDs or flexible collodion, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions. Also, let your doctor or pharmacist know about your medical history, especially if you have skin irritation, diabetes, poor blood circulation, or if you are planning to have surgery. If you are pregnant or breastfeeding, consult your doctor before using this product. And remember to talk to your doctor or dentist about all the products you use before having surgery. It's important to be aware of potential drug interactions when using Freezone Liquid. This can affect how your medications work and may increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms such as passing out or difficulty breathing, they should seek immediate medical attention by calling 911. Otherwise, they should contact a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Make sure to keep up with your regular medical appointments. This will help ensure that you are using Freezone Liquid properly and that it is effectively treating your condition. Don't skip appointments or avoid discussing any concerns with your healthcare provider. If you forget to take a dose of Freezone Liquid, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When storing Freezone Liquid, make sure to keep it at room temperature and tightly closed to avoid exposure to heat or open flames. It's important to keep all medications, including Freezone Liquid, out of reach of children and pets to prevent accidents. When it comes to disposing of Freezone Liquid, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the safe disposal of this product. Remember, it's crucial to handle medications responsibly to protect both your family and the environment. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.